I rise in favor of amendment number 82. This amendment would make it so that anyone in Congress trying to destroy the Affordable Care Act would not be allowed to touch women's health care services. I've been listening to my colleague from Montana and my colleagues in this chamber speak about health care in our country. And after many hours of what I've heard, I'm worried that there's a lack of concern. I'm worried that there's a basic lack of empathy of what's going to actually happen to millions of Americans. And I'm particularly worried about what will happen to women and their children and their families. So I want to spend a moment just talking about what the ACA actually provided for women and what actually will happen when it's no longer there. I'm very concerned that we are barely a week into the new Congress, and too many of my colleagues have already made it clear that their most urgent priority this year is to take our country back to darker days when women could be denied coverage and charged higher health care premiums just because they're women. I'm outraged by this, and I stand with millions of American women and men, moms and dads, sons and daughters that are outraged too. The Affordable Care Act uniquely gave women access to health care on a level that was unprecedented. In fact, 9.5 million more women now have access to basic health care because of that law. In my state alone, thanks to the Affordable Care Act, women can now have access to contraceptive care, cancer screenings, and mammograms. Millions of women who were pregnant or survived diseases like cancer are able to keep seeing their doctors without fear that their health insurance companies will take it away. But too many people in this chamber don't seem to understand that consequence or seem to care about that consequence. After years of talking about, some of my colleagues now feel determined, even entitled, to take away this life-saving health care from millions of women. The election in November was not about women's health care. No one came to Congress with a mandate to take away women's access to mammograms and cancer screenings. But now we are one big step closer to once again making it impossible for millions of American women to see a doctor when they need to access basic medicine, reproductive health care services so they can live happy, healthy, productive lives. And for some, there's the very real risk that if they do get cancer or some other life-threatening disease, they will have to declare bankruptcy just to pay for the health care they need. So I think this is something we must stand together and stop. I think this is something that shows the American people that we understand what's happening to them. I think the consequences are too real, and I think they're too dangerous. And for too many families, the consequences are actually life or death. We should never go back to the days when the insurance companies could tell a pregnant woman, "You are no longer economic for us. We can't make money insuring pregnant women." We cannot go back to the days when insurance companies could tell a breast cancer survivor to go elsewhere because your insurance costs too much. I don't think we should ever go back to the day when an insurance company could simply charge women more for the same plan than men. I don't think we should turn the back on women's basic health care rights. So my amendment makes it very clear that the Senate would be forbidden from directing the committees to cut funding for basic women's health care services. It would ensure that the women's health care protections that we put in the Affordable Care Act would stay there and would have access going forward. It protects the vital services like the disease screenings and comprehensive reproductive care that millions of New York women in my state rely on. So, Mr. President, if my colleagues destroy the Affordable Care Act, it will have real, direct, painful consequences for a lot of women and the families that love them. I think it would be what we call an ultimate overreach by Congress. It would take years to fix. So I urge my colleagues to not let these protections be taken away from American women and their families, and I urge my colleagues to join me in supporting this very simple amendment. I yield the floor.